Welcome to My Counselor Online. I'm Tori, and today we're sitting down with Josh Spurlock, one of our licensed therapists here at My Counselor Online. Josh, I want to talk with you a little bit about Christian sex therapy. First of all,
Do it.
what is Christian sex therapy not?
Yeah, it's a good question. It's not anything that you have seen in movies or on TV or any specials. That there's a lot of really weird stuff out there and a lot of creepy stuff out there in a TV land and world. And that's really the vision of sex therapy that I had when I was in Bible college and then in seminary, that I would have told you that I have no interest in having anything to do with sex therapy, that's creepy, weird stuff, and not something I want to be a part of. So it wasn't until I was actually doing a practicum with a marriage therapist who was also a certified sex therapist and actually sat in and saw what sex therapy was that I was like, oh, I get it. This is something the church really needs. This is something couples are really struggling with and really need. And so that's what inspired me to kind of pursue becoming a sex therapist, in spite of kind of the weird, creepy vibe that I had about sex therapy.
Yeah. And kind of leading into that, what is a Christian sex therapist? Can you even do that? Can you even combine, Christian therapy with sex? What does that look like?
I know, right? You're in church and it feels like if we talk about sex, maybe the ceiling will cave down on top of us. Like we're not allowed to talk about sex. But in reality, sex is God's idea. Like we didn't come up with sex. This wasn't our idea. We didn't invent this. Culture didn't invent this. That God invented this. It was his idea. And so if anybody ought to be talking about it, it ought to be God's people, right? That we ought to be celebrating what it is our Creator designed and put together. We ought to be the ones laying out there what healthy sexuality is and what it means. And it's not a list of don'ts. That's oftentimes what we think about within the church when it comes to sex, is it's a list of don'ts. But instead what it is, it's a list of do's about passionately connecting as a couple in a way that really reveals the heart of God and the kind of relationship that he wants to have in the divine marriage between his church and himself. And so Christian sex therapy is really about having that framework, the understanding of what God designed sex to be and the purpose within that and the beauty within that, and helping couples experience that in their relationship, where life and brokenness and sin and distortion and pain have somehow messed that up for them, so where they're not enjoying it the way that God designed it to be. And it's creating pain and conflict instead of something beautiful and connective and God reflective. A Christian sex therapist comes into that scene and helps them figure out what is not working here and how can we remedy that so you can be experiencing what God always intended for you to experience in this part of your life.
I love that. And you mentioned a few different problems in the article that a lot of couples, a lot of individuals face, and reasons why some might choose Christian sex therapy. And I wondered if you could just expand on a couple of them. The first being a lack of sexual fulfillment. What does that look like for a couple to be experiencing?
Yeah, so around our sexuality, particularly if we grew up in the church, there's not a whole lot of conversation about sex, right? There's not a lot of conversation or dialogue or teaching about the nuts and bolts of sexuality. There's kind of this assumption that you'll just kind of figure it out, right? And that if there is a sex talk, the sex talk consists of don't have sex until you get married, right? And don't think about it and don't want to think about it and don't feel sexual feelings either, because all of that is like terrible, right? That's kind of what it consists of. And so we come into marriage oftentimes really sexually naive, that there's this disconnect between our own sexual experience because we've felt maybe shame around feeling sexual feelings, having sexual thoughts. And so we've tried to shut down that part of our experience. And so we've got that we're trying to figure out how to unpack. And that has really inhibited sexual exploration in terms of being aware of our own body and sensation and what feels good and what orgasm is like, and how to pursue that and develop that sexual tension in our body in a way that creates that reflex of orgasm within the body. And so the lack of knowing our own body and our own sexual experience, and the lack of knowing how to be a good lover in the relationship and with a human being that's different than us, whether that's a man trying to engage his wife, and his wife's a woman, right? And very different than himself and his own experience of his sexuality. So if he tries to engage her in the same way that, makes sense to him and maybe how he would like to be engaged, she's not going to experience that so good. And likewise, if she assumes that he experiences his sexuality the same way that she does, and just kind of engages him the way that she would like to be engaged, that's not going to feel fulfilling to him. And so we have this experience at times where we just don't know how to connect in a way that feels mutually satisfying. We're like either we're actually not orgasmic, and we have one or both of us aren't experiencing orgasms when we connect. And so there's not that sense of sexual fulfillment and release that comes with connecting. And so there's something's missing here. That this is, it's okay, but it doesn't feel all that great. It's not really something that maybe I really look forward to, because it's not all that fulfilling, not all that satisfying. And so that affects my desire, which it affects my responsiveness, which it affects the relationship between us and creates conflict. And so sometimes the problem is just a matter of needing to understand how our bodies work and how to engage each other in ways that complement one another and can be really fulfilling for each other.
Absolutely. Yeah. And another problem that you mentioned that many in this world struggle with is sexual abuse and trauma and rape, and just the emotional wounds that come from those experiences. Are those covered in sex therapy? How do you even approach that subject?
Yeah, oftentimes people don't even realize how much it impacts them. Like oftentimes I'll have couples come into my office and they're having difficulty in their sexual relationship, and they're here to try to work through those difficulties. And as we gather a history and get our head in the case and figure out what's going on, we find out that there's some sexual trauma that's a part of their story, whether that's incest or molestation or traumatic experience or rape or something of that sort. And it doesn't even occur to them that that could be influencing their difficulties that they're having together with their spouse, right? Because that was a long time ago and didn't involve my spouse. And so, and when we were dating, I was super horny and we enjoyed connecting or pursuing or felt the desire to connect. And so how could that have anything to do with this? And what we don't realize is that when we're dating and we're in that early relationship, that adrenaline and dopamine supercharge our sexual arousal at that time in a way that can really cover up and hide sexual aversions that are part of our experience. And what a sexual aversion is it's a pairing that takes place. It is one of the best ways I know to explain it is if you've ever eaten a food that you really enjoy and then got sick afterwards and threw it up and vomited up. And even though maybe it had nothing to do with that food per se, you just can't eat it anymore, right? That you used to love it, but now it's like blah, 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 to think about it. When we have a negative emotional experience paired with some other experience, the two get connected. And so when we have a negative emotional experience involving our sexuality in some way, that can get paired with our sexuality. And so now the sexual experience, but connecting with my spouse, even though it's unrelated to the negative emotional experience that I had before, brings up those feelings that were a part of that previous experience because they're paired together. And so that can really shut down arousal, really shuts down the sexual experience and keeps it from being a positive, enjoyable thing, which creates all sorts of confusion. You know, oftentimes the spouse is like, is it me? Is it about me? You know, what changed? You seem to be into me and like me and want me sexually earlier in our relationship, and now you don't seem interested at all. And sometimes it's really confusing for ourselves. Why do I respond this way to my spouse? I love them. I see this as hurting them. I don't want to respond this way, but I don't know what's going on with me. So it's really confusing and painful. And a sex therapist gets in the middle of that and is able to assess what's going on and understand, oh, it looks like we've got an aversion here that's formed from some negative experiences that we've had. And here's how we go about finding healing in those things and unpacking that in such a way that frees us up to really enjoy the time of connecting with our spouse. So yeah, that's another common reason why folks present for sex therapy.
And we've talked through now a couple of the reasons, the struggles listed in that article. We've talked about what Christian sex therapy is, what a Christian sex therapist is. So now, what is the experience like? What is Christian sex therapy like?
Yeah.
Just going in and talking through it and all of that.
Yeah, good question, right? Because if you're taking your cues from television or movies, you've got a picture in your head of what sex therapy is that is totally unlike what sex therapy actually is. First of all, sex therapy happens in a professional context, right? It happens in an office, like any other kind of therapy takes place. It doesn't happen in your bedroom. It doesn't happen when you are connecting intimately or trying to connect intimately with your spouse. Sex therapy is a conversation. It's a dialogue between you and a professional who's trained in troubleshooting these issues for couples. And so you can expect it to look a lot like other kinds of therapy, that you would come to either your video session or come to the sex therapist's office, and the sex therapist is going to have questions for you about your experience, and they're going to know the right questions to ask to gather the necessary information to diagnose what the difficulty is and to put together a treatment plan that involves conversations that are had in the office and involves homework assignments that you and your spouse would do outside of the office in the privacy of your own home, engaging and practicing some things, and then coming back to the therapy session, the next therapy session, and sharing what your experience was, what happened, how did it go, where did you run into difficulties, what did you learn, in a way that then enables the sex therapist to take that information and make the next suggestion as based on what you experienced with this homework, here's what we need to do next in order to advance towards the goals that you have. So that's what sex therapy tends to look like. Oftentimes that homework will involve books or resources that the sex therapist, after hearing your story, gathering the information, goes, okay, this is the right resource for you amongst all the different resources that are out there, which can be overwhelming to look at and go, I don't know which one's the right one and which one can I trust. Sex therapist knows what the resources are. Once they know your story and what you're dealing with, is going to know the right ones to offer you that are really going to speak to what it is you're experiencing.
How long does this typically take, sex therapy?
100 years, your whole life. That's the fear that we have sometimes, right? That I'm going to be in therapy for the rest of my life. It's expensive and it's going to take forever. And, does it even work anyways? Those are common anxieties and fears for folks to have. And I'd love to give you like an exact answer, but the truth is it varies widely depending on people's situation and what the difficulty is that they're having, right? I've had sex therapy sessions that were a single session. that I met with someone, they came in, they kind of laid out, here's what I'm experiencing. I'm not sure if that's normal or not, or what to do about it. After hearing what it is that they're experiencing, I ask some questions and go, I think this is pretty common, and try this and do this. And that's all they need. And that kind of resolves it. It's an informational gap, not knowing what they can trust, how their experience lines up with what's normal and what to do about something. We give a little bit of direction, answer those questions, and that's it. That's all we need. Have other experiences where we have an experience or an event that sets into motion several things that cause it to snowball into a bigger problem. And once we clear the slate, we identify what's going on, walk through a series of exercises, and maybe in 7-10 sessions, we have achieved the goals that the couple come in with. That happens. That's a normal kind of 6 to 12 session course of treatment and therapy. And they have other situations where maybe there has been some abuse or been some trauma in the experience of one or both partners. Or maybe there's some relational dysfunction and brokenness, that the larger relational context has got some struggles within it. And that in order to address the sexual difficulties that we're having, we first have to address the fact that we can't have tough conversations without it turning into a blow up or fight. If we can't have tough, vulnerable conversations without it turning into a blow up or fight, we can't talk about the vulnerable subject of sex in our relationship. There's not safety for it. There's not the communication skills for it. So we end up having to do actually marital therapy first before we can engage the sex therapy piece of it. And that takes a little bit longer because there's just other things that have to be addressed. If a couple comes in and we're having disconnect sexually, and as we get into the story, find out that there's a recent affair that's happened, or that there's pornography or there's something of that nature that's in the mix, that's a big deal. We have to address that and work through that if we're going to be able to then get to the sexual difficulties. So that can turn into a number of months of work that we're doing together. So it really depends on your unique story and situation. Can be as little as a single session, can take several months in order to work through things. Just depends on what it is you're bringing to the therapy.
Everyone's so different, and everyone's story is so different. And I appreciate the intentionality of our counselors in really getting to know people and their struggles, and pouring into them in the ways that they need in their marriages. So I think it's safe to say that Christian sex therapy is important and also sometimes necessary in the world that we live in today.
Absolutely. That there's just some challenges that we experience that we need some help working through. And this is especially true around the sexual part of our life. There's so much distortion and brokenness within the culture around sexuality, such a distortion of the enemy around messaging around sexuality that really affects how we see ourselves, how we see sexuality. And it's such a vulnerable, precious part of who we are as a person, individually, and of our relationship, that I really believe that the enemy attacks that part of us. Because when people are wounded sexually, it cuts them to their core in such a deep way. And when there's sexual struggles and difficulties in a marriage, it creates such a disconnect emotionally in the unity within a marital relationship. And so an attack on that part of our personhood and our relationship, I believe, is really strategic on the part of our enemy in creating brokenness in our personal life and in our relational life. And so with that kind of attack from culture and from the enemy on that part of our experience of life, there's just a need for healing to take place in our own heart and in our relationship in order to find restoration to what God's really designed our sexuality to be and the gift that it is that he's given us.
Yeah, so We invite you to read this article, take a look at the resources, reflect on the many reasons that people pursue Christian sex therapy, and the parts of your heart that might need healing, and that the Father wants to heal in you. So thank you, Josh, for sitting down with us and just discussing this article. It's so important, and I appreciate your time and your intentionality in talking with us.